thank you for joining me today. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And today I'm going to explain how you can help your patients or clients save on their healthcare expenses with NeedyMeds. Before I get started, I'd like to go over a few tips so you can make the most out of today's presentation. You can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get the chance to answer your question, I will follow up with you via email. And of course, I will provide my contact information and the contact information for NeedyMeds at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find a copy of my PowerPoint slide deck in the handout section of your control panel. Today's webinar is going to cover what NeedyMeds is, the healthcare savings resources we offer. We also have tons of educational resources. I'll explain everything you need to know about our drug discount card, and of course, other ways that we can help you to better serve your patients or clients. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit that was founded little over 2 decades ago by retired family physician, Dr. Rich Sagel. Rich is still our president. And this slide has all of the fancy wording about our mission statement, how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do this free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And one of the most popular and effective ways we help people to save is with our listing of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program. When one is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare provider usually needs to be involved by providing the prescription, signing the application, and submitting the documentation. So, how do you find prescription assistance programs and other healthcare cost savings resources on the NeedyMeds website? Bear with me while I transition out of the PowerPoint and onto our live site so I can demonstrate. So here is the NeedyMeds homepage. You can begin searching for a cost savings program by typing the name of the medication into the drug search bar on the top left where my cursor is blinking. To find a prescription assistance program, let your mouse hover over or click on that Patient Savings tab. As you can see, a whole bunch of categories pop up. On the top left side, there is a category dedicated to prescription savings. And there are a number of ways you can search. You can search by the least common company or program name, but you can also search according to the brand name of the medication. So let's say we're looking for help affording a brand name drug called Eliquis. I'll go ahead and click on that brand name drug hyperlink. And the first thing that happens is a bunch of icons pop up. What these icons do is they show you what type of information is available for that drug. Is there a cost savings program like a prescription assistance program or a coupon? Is there more information available for that drug with support pages, which will provide hyperlinks that have details about that medication, or drug videos, which is exactly what it sounds like, short videos offering more information about that drug. The eye icon is new. If you're seeing this icon, it means there is additional information about the medication on drugs.com. You will also notice the convenient A to Z index. For the large sections on our website, we have this alphabetized list to make your search easier. So let's return to our search for Eliquis. I'll choose E in the A to Z index. I'll click on that E hyperlink, and then I'll scroll down to see if that medication is listed in the long alphabetized list. When it is, you click on it, and there are those icons again. The icons again let you know that there's more information about the drug. The eye brings you to drugs.com. There's a video about Eliquis. There's some support pages. This link indicates that there is a coupon available, and the hyperlink on the far left indicates that there is at least one prescription assistance program available. That's a hyperlink like the rest, so I'm going to go ahead and click on that hyperlink. And actually, as indicated in this blue bar, you can see it says program 1 of 2. That means that there are 2 prescription assistance programs available to help your patients afford Eliquis. When there is more than one, like in this case, the program that offers the most assistance will be listed at the top, and the ones that offer lesser assistance will be listed at the bottom. Now, I'm going to make the screen a little bit smaller. Don't worry about being able to see the text. I just want you to look at what a quick snapshot of our prescription assistance program pages look like. So let's talk about the details on this screen. At the top, you're always going to find the name of the supporting organization and their contact information. And that's really important because if you or your patient or client has any questions about the program, you're going to want to contact the program directly as opposed to NeedyMeds. Next is the program application section, where you will often find a hyperlink to the application. In the rare instances where the hyperlink to the actual application isn't available, you will find more. It will direct you to further information. Under that is the medication section, where you will find all the medications that are covered by this prescription assistance program. And of course, each program, very importantly, has an eligibility requirement section. And as I stated earlier, although eligibility will vary from program to program, it is almost always based on 3 factors: insurance status or coverage, residency, and the person's income. Be mindful of the application section. This has more information about if or how the doctor needs to be involved, for example, and the time frame which you can expect a decision. The medication section is also important because it lets you know, for example, where the medications would be mailed and details for reapplying. Always check out the additional information section because that is where we put other pertinent information that does not fall neatly into the other categories. Now, before we move on from prescription assistance programs onto other cost savings programs, I want to return to that patient savings tab. I want to return at the top to the advocates tab next to that patient savings tab. And on the bottom left-hand side, I want to point out to you HAPTracker. If you and your staff do help your patients with prescription assistance program applications, you know it can take up quite a bit of time. That's why we created HAPTracker, which is a software that eliminates the administrative burden of having to manually track and submit applications. Send me a message in the questions section if you would like to learn more and or receive a free demonstration. So let's move on to other ways to save on healthcare expenses. Returning to that patient savings tab, also on the top left on that Save on Prescriptions category, I'm going to go ahead and click on that $4 generic discount drug program. This is a directory. I'll make it a little bit smaller. This is a directory of all discount programs for generic medications available at major retailers. Now, although it's called the $4 generic drug discount program, most will range in price from between $4 and up to $15 for a 30, 60, or 90-day supply. As you can see, you can search a number of ways. For example, you can see to search for a particular drug. You can search to see if there's a particular store or pharmacy that is participating in this program, or you can search really broadly by state. So just to demonstrate, I'm going to go ahead and choose the state of Michigan. So as you can see, the results yield that there are currently 14 stores or pharmacies in Michigan that are participating in the $4 generic discount drug program. And I hope you'll agree that all of the pertinent information is now on your screen, including the participating store or pharmacy name and a hyperlink if one is available, the program name, and most importantly, on the far right-hand side, under the column titled Program, it will let you know exactly what this store or pharmacy will help you to save. And again, most of these programs will range from between $4 to up to $15 for a 30, 60, or 90-day supply. But it does vary, so be sure to check it out. You'll also notice that you'll see major chains such as Rite Aid and Walgreens. But for example, there are other more local or regional chains. So be sure to check it out. Now I'd like to move on to another really helpful section and popular section on the NeedyMeds website, also under that Patient Savings tab, which is our free, low-cost, and sliding scale clinics database. We actually, about a year ago, updated this database to make it a little bit more user-friendly by breaking it down into 4 categories: medical clinics, dental clinics, mental health clinics, and substance addiction clinics. Now, they're all set up exactly the same, so for purposes of this demonstration, I'm just going to go ahead and click on medical clinics. Now, this is a really large section of our website. As you can see, there are just under 17,000 free, low-cost, and sliding scale clinics in this database. That's why I suggest doing a zip code search as opposed to a broader state search. Let me show you what that looks like. Let's do a zip code search, see what's available in 90006. Let's assume the person does have transportation or is able to get within 5 miles of that zip code. And the results yield there are 68 clinics within 5 miles of that zip code. And again, like the previous database, all of the pertinent information is on your screen, including the clinic name, contact information, and a website if one is available. The eligibility, which lets you know, for example, who can be treated at the clinic and what fees can the patient expect to incur. And the far right-hand column titled Details lets you know what services does the clinic provide. And oftentimes clinics do offer a wider range of services other than just simply medical doctor's appointments. For example, this clinic listed at the top orders counseling and nutrition and women's health, treatments for diabetes. And one thing I do want to mention is, although we pride ourselves on the information on our website being accurate and up to date, please always call the clinic or visit their website to confirm information that you or your patient would find really important, such as what fee will they be charged, and does the staff there speak another language. A really helpful tool is the printing option on this page. Let's say you wanted to print a list of all 68 of these clinics. You can do that by clicking the Print All list. But let's say you want to scroll through this list and cherry pick only the clinics you think your patient would be interested in. In that case, you would click on the box, choosing only the ones you think your client or patient would be interested in, and then click on the Print option. This will generate and print a list including only the ones you chose. And again, that's a great tool for healthcare professionals if you want to provide your clients with a list of clinics for them to choose from. Now, again, if you do have any questions, don't hesitate to type them in to that question section of your GoToWebinar control panel. While those questions come in, let's move along. Returning to that Patient Savings tab, I'd like to just review with you on the bottom left-hand side our coupons and rebates category. And this is where you can find prescriptions and over-the-counter medications or supplies for which there is a coupon, a rebate, a savings card, a free trial offer, or a free sample. Like the other sections on our website, you can search a number of different ways. You can search by the name of the drug. You can search by the name of the product, But you can also search by category, which, as you guessed, means medical category. Let me show you what that looks like. When you click on that hyperlink, it'll take you to an alphabetized list of medical categories. Let's say you have a patient living with high blood pressure. For example, you'd click on that hyperlink, and there are those icons again. That's really helpful because that means if you see a drug or product listed, it will also let you know whether or not there's additional cost savings programs available. For example, is it available through a prescription assistance program? Can you get it through the $4 generic drug discount program? And is there more information about that drug or product available through support pages, drug videos, or drugs.com? And here's what the listing looks like. In the last year or so, we actually updated this page. It used to be a paragraph explaining what the coupon provided. We've actually made it a little bit easier to read, we think, but certainly be vocal about your experience. Instead, we just put a sentence or two and then a bullet-pointed list with the most pertinent information. You'll also always find a link to the manufacturer's offer website. And we did put a convenient way to request the NeedyMeds drug discount card here. And of course, a little bit later in the presentation, I'll talk to you about how you can help your patients save with the NeedyMeds drug discount card. So let's talk about diagnosis-based assistance programs. Diagnosis-based assistance programs provide financial assistance for costs associated with a particular diagnosis. Now, this category is different because, for the most part, it excludes medicines. What it does include instead are other necessary medical expenses, such as medical supplies, medical equipment, testing supplies, or even things like help affording wigs, house cleaning services, or assistive technology. You can search simply by diagnosis, state, or the least common, for example, program name. But let's see what healthcare savings resources are available for those living with diabetes, for example. So I'll go ahead and click on the hyperlink for diagnosis. Because this is a large category on our website, you will find that helpful A to Z index. I'll go ahead and choose D. And then I'll scroll down to see a listing for diabetes. Now, because that's a broad category, it's broken up into a bunch of more specific subcategories. But I'm going to go ahead and click on the general hyperlink for diabetes, just so you can see what the results will yield. And there are currently 82 diagnosis-based assistance programs for diabetes. And the reason I keep using language like that, because right now there are this many programs, or currently there are this many programs, is because we have an entire research team dedicated to not only keeping the programs we have listed accurate and up to date, but to adding new programs and cost savings resources. So if you are looking for help affording a particular medical expense or drug and you can't find it on our website, please check back to see if it has since been listed. And I also want to encourage you not to hesitate to reach out to our call center counselors. We are located in Massachusetts, so we are open 9 to 5 Eastern Time, Monday through Friday, and we do have Spanish-speaking counselors. So let's return to that listing for diabetes. And like the other search results, we hope you'll agree that all of the pertinent information is on your screen right now. You'll see the name of the program and a hyperlink, a summary about the program, and the two right-hand columns of what you'll be most interested in. Services provided and the areas of service. The services provided lets you know exactly that. What service does this program provide? And as you can see, it varies greatly. Many of them offer assistance affording medical supplies or assistive technology. But as you can see, it varies quite a bit. This one, for example, offers help with respite care. These offer assistance getting access to a service animal. Now, the areas of service column lets you know where the patient needs to reside to be eligible. And you'll notice it keeps saying national. That's because we list all of the national programs at the top. National meaning, regardless of where you live in our country, you are eligible to apply. And then underneath the national programs, you will find state programs alphabetically. Now, because we're talking about diagnosis-based resources, I'd also like to take just a moment to point out under that Patient Savings tab our diagnosis information pages. These are exactly what they sound like. They provide educational information and healthcare savings resources for those living with or caring for someone with a specific diagnosis. These are really great for somebody that has also been newly diagnosed. It also gives me a chance to highlight a new educational resource we've just added. On our heart-related diagnosis information pages, like heart disease, for example, if you go ahead and click on that, we added a new tool. In the resources box, you'll see a hyperlink for reducing cardiovascular risk. So please share this tool with your patients or clients, and you can find a PDF of this in the handout section of your GoToWebinar control panel. And if you have difficulty accessing it, don't hesitate to send me a message in that question section of your GoToWebinar control panel. Now, right beneath that diagnosis-based assistance program, you'll also find another newly added resource, which is our COVID-19 Resource Center. We put this together specifically for those experiencing financial hardships and struggling with healthcare expenses due to COVID-19. And again, you can search for a number of ways. You can search by probably the least common program name, but you can also see what programs are available in your state or nationwide. And again, nationwide meaning regardless of where your patient resides, he or she will be eligible to apply. And if you're aware of a program that we don't have listed, please don't hesitate to share that with me. You can shoot me an email at carla@needymeds.org, and we will get that up on our website as soon as we can. So moving on, under that Patient Savings tab, we also have sections dedicated, for example, to, let's make this a little bit smaller, to medical transportation. Now, we recognize that getting to and from a doctor's office or specialized facility can often be a burden, so we've put together a directory to help people with their medical transportation needs. We also have sections for camps, retreats, recreational programs, and educational scholarships. And as you guessed, these are all camps and programs and diagnoses for those living with a specific diagnosis. Another great resource is our government program section. This is really helpful because not only does it list all state-sponsored programs, but it also has pretty exhaustive information on Medicare and Medicaid. So that's wonderful if you're helping a population that are beneficiaries of those benefits. So now, in the beginning of the presentation, I mentioned we also have a ton of educational resources. And you can check all of those out under the Advocates tab. Let me make the screen a bit larger. So this is where you can order print materials, you can sign up for email alerts about program changes, you could read more about HAPTracker, which was the software I mentioned earlier. You can sign up for our webinars, you can sign up for our monthly newsletter, which is called Vitals, and we encourage you to visit BeMedWise, and that's a great educational site dedicated to the safe use, storage, and disposal of meds. And you can also learn about other ways we can partner, which I will talk to you about in just a bit. And you can find that under the partnership brochure on the right-hand box. But for now, I'd like to switch back to the PowerPoint so I can talk to you about another important way you can help your patients save, which is with the NeedyMeds drug discount card. So, like other drug discount cards, the way the NeedyMeds drug discount card works, and the card can be a physical plastic or paper card, or can also be an app. You take the card to the pharmacy, you match it with, you match it with a prescription and save. And as you know, there are a ton of other drug discount cards out there. But the NeedyMeds drug discount card is free and anonymous. That means we do not track personal data, so confidentiality is guaranteed. There is no enrollment, no registration, no residency requirements, and no activation. And the NeedyMeds drug discount card is accepted at more than 65,000 pharmacies nationwide. The NeedyMeds drug discount card can be used to save on prescriptions, over-the-counter medications and supplies written as prescriptions, and it can be be used to save on human equivalent pet meds. You can also use the card to save 40% off medical equipment. So the big question is, who can use the card? And the simple answer is anyone. The only rule is it cannot be combined with insurance. So if your client or patient is uninsured, they can use the card anytime. If they do have insurance, they may choose to use the card instead. And they may do this, for example, if their medication isn't covered, maybe their copayment or deductible is too high, maybe they find themselves in a coverage gap, or maybe they've exceeded a cap for drug coverage for the year. I'll also mention that the NeedyMeds drug discount card can offer a better price than insurance 5 to 10% of the time. So it's worth comparing at the pharmacy which gets you the better deal, your insurance coverage or the drug discount card. So let's move on to other ways we can help you to better help your patients afford their health care. So the easiest and most simple way to help your patients is to simply be aware of NeedyMeds and direct them to our website or helpline. And again, it's just referring somebody to our website, or importantly, our toll-free helpline, because sometimes it's easier to speak with a person. Please don't hesitate to do that. Also, if you have other colleagues interested in learning about NeedyMeds and the resources we offer, I would be happy to conduct a personalized webinar training. You can send me an email or shoot me a message in that questions section of your GoToWebinar control panel. As I pointed out under that Advocates tab, you can sign up to receive our newsletter, program updates, print materials, and more. And under that same Advocates tab, you will see a link to our Patient Assistance Resource Education, PAIR, course and exam, which is a web-based, self-paced tutorial on how to find healthcare cost savings programs on NeedyMeds.org. We do provide a certificate of completion for those that finish the exam. We usually charge $15 for the PAIR course and exam, but it would be our pleasure to waive the fee for today's webinar attendees. So if you're interested, you can send me a message in that question section, or you can shoot me an email. We also hope you register for and share our upcoming webinars. Please sign up under that Advocates tab to receive our monthly e-newsletter Vitals and our monthly webinar announcements. And on the top right hand of our homepage, you'll see a bunch of the top right hand of our homepage, you'll see a bunch of icons. It's a whole bunch of social media icons. And in there, you will also see an icon for our YouTube channel. So we hope you do subscribe to that. It's a great way to be sure you don't miss any new content, including videos, webinars, or presentations. We'd be happy to provide you with an unlimited supply of our drug discount cards and most popular brochures. They're not doing anyone any good sitting on our shelves. And let me know if you're interested in having us create a customized drug discount card with your organization's name and logo. This is completely free of charge. So again, if you're interested, just let me know and I'll get in touch with you about how to proceed. Of course, we encourage you to add NeedyMeds to your website and post about us on social media. And if there is a free upcoming event you want to get the word out about, feel free to shoot me an email with the information and we'll add it to our calendar of events. We can also provide you with the tools you need to incorporate information on prescription assistance programs directly onto your website. And we already talked about HAPTracker, and I also wanted to point out to you that there is also the option of licensing our data to be added directly to your website. Now, those last two bullet points are asterisked because there is a fee involved with both of those. The rest of the tools I suggested are free. And in that handout section, I did include our partnership brochure for you to review when you get a chance. Or again, you can always find that under the Advocates tab on the right-hand side. So as promised, I want to take some time to get to the questions that are coming in. And as I do, I want to leave up some contact information. At the top, you'll see a contact information for my colleague, Alana. Please reach out to her if you're interested in ordering a bulk supply of drug discount cards and brochures. If you have questions regarding this webinar or any of the topics we covered, don't hesitate to reach out to me at carla@needymeds.org. Please take time to visit our website and peruse it a little bit further. This is just an overview. So as you hopefully saw, there's a lot more resources on that site that we didn't have the chance to go over. So I encourage you to peruse it when time allows. And again, don't hesitate to reach out to our English and Spanish speaking counselors at our toll-free helpline Monday through Friday Eastern Time, 1-800-503-6897. So we're going to go ahead and get to some of the questions coming in. So one of the questions coming in is, why do so many programs exclude those with Medicare Part D? Many of those with Medicare are living with very limited income and are on high-priced medication. That is a question and a comment we get regularly, and I will have to agree that many of the programs, especially prescription assistance programs, often do exclude those with Medicare Part D. What I do want to stress, however, is that we do have under that patient savings tab a whole other category of cost savings programs. So if you can't find assistance under that prescription assistance programs, don't forget to check out the $4 generic discount drug program and especially our diagnosis-based assistance program. I also want to encourage you to make sure your patients have our drug discount card on hand. Oftentimes that will come in useful if there's a medication that is still exorbitantly priced through insurance. We consider our drug discount card a safety net, and there's no reason not to have it. It also gives me an opportunity to mention that if you're not having luck finding a cost savings program for a particular medication or product, I always stress to call our counselors because they may have a creative idea or way that they can help your patients to save on their medication. Thanks for the question. Here's a question coming in about whether or not the slides that I'm going through right now are available to download. They are. You should be able to find a copy of my PowerPoint slide deck in the handout section of your GoToWebinar control panel. There are actually 3 handouts in that section. One is my PowerPoints. One is the cardiovascular risk tool, which we think your patients will find really useful. And the third handout in that section is our partnership brochure. If you have difficulty accessing it, don't hesitate to shoot me a message and I'll be happy to email it separately. So here's a great question. Unfortunately, we have an audience member who has a local pharmacy that doesn't accept drug discount cards. How do you get them to accept them? Well, on the back of the drug discount card, there is a customer service number for patients, but there's also a customer service number for pharmacies if they are interested in joining the family of 65,000 plus pharmacies that accept the drug discount card nationwide. It really is beneficial for them to join us, but also don't hesitate for them to shoot me an email personally at carla@needymeds.org. Thanks for bringing that to our attention. And for those of you that reached out interested in trainings or HAPTracker or PAIR, the course and exam, I will follow up with you after the webinar. Thank you so much for your interest. I really appreciate that. And let's get to some other questions coming in. How does NeedyMeds support itself? That's a great question and one we get all the time. And you can find that answer under the About Us section, which is at the very top of the NeedyMeds website. on the page that has our mission statement, it lists the 6 or so major sources of financial support NeedyMeds relies on to keep going, because as you know, we are a nonprofit. We do license fees for our organization's use of our databases. As you know, we do sell HAPTracker software. We get a small transaction fee for every time the NeedyMeds drug discount is used. We do have thoroughly reviewed supporting partners on our website. We get fees from pharmaceutical companies for call center and application processing services. And we do rely on corporate and individual donations like every other nonprofit. Another question coming in is, in the beginning, you mentioned you can use the drug discount card to save on pet meds. How? Actually, we did put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. You can go to the NeedyMeds YouTube channel and type in the word pets into the search bar, or you can email me or shoot me a message in that question section. I'd be happy to send you the link. Oh, and another question about our call center, which is what time is the NeedyMeds call center open? It's a great question. We are open from 9 a.m. to 5 p.m. Monday through Friday. Keep in mind we're located in Massachusetts, so we are on East Coast time. So we're going to go ahead and wrap up today's presentation because I do like to keep the question segment brief. If you did ask a question that I didn't get the chance to answer, again, I will follow up with you via email, and we do hope that you stay in touch. Join to receive our monthly newsletter or sign up for some of our upcoming webinars. For now, thanks so much for taking time out of your day to learn how NeedyMeds can help you to help your patients save on their healthcare expenses. Thank you so much. Stay safe.